guess what this is? My name is Sydney Morgan, and this is my final project for human anatomy on the female reproductive system. And this is an ovary. Starting on the left side, this is the medial pole of the ovary. The ovarian ligament is attached to the ovary inferiorly, and it connects the ovary with the uterus. On the right side is the suspensory ligament, and this connects the ovary to the pelvic wall via the peritoneum on the interior side. This is also the lateral pole of the ovary. On the posterior side, the suspensory ligament is attached to the upper pole of the ovary and the infundibulum of the fallopian tube via the broad ligament. Moving along, the interior of the ovary is divided into the central medulla and the outer cortex. The cortex is a site of ovarian follicles, and the ovary is encapsulated by the tunica albuginea. Okay, so all around the ovary, we can see that there are primordial follicles, as you can see, and these become primary follicles by birth when the girl or the female is born, and most of them die by childhood. So the primordial follicles, they become primary follicles, and this starts the development of the follicle that we'll be discussing, or also known as folliculogenesis. Each follicle consists of one developing ovum surrounded by lots of small follicular cells. Again, so the primary follicle develops into a secondary follicle, and by this time, granulosa cells also develop because it's layered. As you can see, the nucleus is indicated by the center of the bead, and of course that's an oocyte, as you can see here. And this is a tertiary follicle because the antrum initially occurs here in the tertiary follicle. This is what a mature follicle looks like. And then coming on down to this area, this is an ovulated oocyte, and it's got an overwhelming amount of follicular fluid that's just kind of bursting there. This is what happens on day 14 of the menstrual cycle. And coming on down to the corpus luteum, this is what happens after the follicle has ovulated. This is an endocrine organ, actually. It secretes progesterone, and this also stimulates the uterus to prepare for possible pregnancy. So if the female is pregnant, the corpus luteum will stay active for 3 months and continue to produce progesterone to support the fetus. But if the female is not pregnant, the corpus luteum becomes corpus albicans. And this is basically like an active scar or scar tissue because there is no pregnancy. And there you have it. This is the follicular genesis. As you can see, the ovarian artery and vein come through the suspensory ligament and just become part of the ovary, supplying blood. And that's it. Thank you for listening.